Good afternoon, and thank you all for joining CQ Roll Call and the March of Dimes for today's virtual town hall, Demanding Blanket Change, a movement to prioritize our nation's moms and babies. My name is Mary C. Curtis, and I am a columnist at CQ Roll Call, as well as host of its Equal Time podcast. And I'm delighted to be joined by Stacey D. Stewart, who's the president and CEO of the March of Dimes. Before we begin, I'd like to remind everyone watching to ask questions throughout the town hall using the chat function or of whatever you're viewing. Our teams will be monitoring and responding to questions throughout the program. Now I'd like to begin by setting the tone for today's discussion. In 2020, the United States is still among the most dangerous developed nations for a woman to give birth. And it's even more dire for moms and babies of color. Now, this is a health crisis that has only intensified with the COVID-19 pandemic. Today, we bring together policymakers, subject matter experts, and community leaders to learn more about the critical policies needed to prioritize and improve the health of our nation's moms and babies. Stacey, we're here today to discuss how we can make America a safer place for mothers and their babies. March of Dimes has been at the forefront of this movement, and your latest campaign, #BlanketChange, is about demanding change from our elected officials and community leaders. So can you tell us more about your advocacy work?
Absolutely, Mary. Thank you so much. And thanks for that introduction. And we want to thank CQ Roll Call for hosting this really, really important conversation. And for those of you joining, whether you're a policymaker, whether you're a health practitioner, a mom, just an interested citizen of this country, we want to invite you to join this conversation and be a part of it. Certainly being a part of asking questions and engaging in this conversation for the next hour or so. I do want to get into a little bit of more of the context of this issue. Mary, you touched on a little bit about the nature of the maternal and infant health crisis that we're facing in this country, which is dire for many moms and many babies. And as you mentioned, in 2020, it is shocking for many people to realize and to understand and to even hear that the U.S. is among the most dangerous developed nation in the world in which to give birth. And what we also don't know are just some of the statistics around that every 12 hours, a woman will die due to complications due to pregnancy and childbirth, that 2 babies will die every single day and will not make it to their first birthday. This is just really shocking. And it also comes at a time when we're dealing with this incredible social and racial reckoning. A lot of what we've seen over the last few months has been complicated by a global pandemic, but also just tremendous social unrest due to racial inequity in this country. We do have serious complications and pregnancy complications that are faced by many women, but especially there are serious complications faced by women of color, where Black women today are 3 to 4 times more likely to die as a result of pregnancy and childbirth as compared to white women. We just recently issued a report at the March of Dimes just in the past month or so called Nowhere to Go. And it really details what we call maternity care deserts. A lot of people have heard of food deserts. But what we look at are maternity care deserts. These are counties in the country that offer virtually no obstetric care. There's no hospital that offers obstetric services, no OBGYN, no certified nurse midwife, and no birthing center. And this affects about 35% of all counties in the country. About 2/3 of them are in rural areas, about 1/3 in urban areas. It affects about 2 million women and about 500,000 babies that are born each year. There are about 54% of all counties in the country that have either no access to obstetric care or very limited access. This is really an issue that is simply unacceptable in this country. We are every day putting more women and their health at risk. We're putting more moms and babies and their lives and their health at risk. And of course, now with COVID-19, the stress in our healthcare system is made even worse. And the conditions and the risks that we're putting moms and babies in today is made even worse. So we have a really serious issue on our hand. And I think it's safe to say that moms and babies need us now more than ever. So I know that some of these statistics can be very shocking and sound very bleak, but here's what I'm here to tell you, and that is that there is hope. And that's what the March of Dimes is all about. We are the leading nonprofit fighting for the health of all moms and babies, fighting on every front, whether it's around research or programs or advocacy. And we do this by working at the state level and at the federal level. We work with healthcare providers, policymakers, a whole range of interested parties, and through partnerships to make sure that we can change the course for moms and babies in this country. And that's what we're doing right now with this campaign called #BlanketChange. We are advocating for the health of all moms and babies. We have 70 organizations that have signed on to be a part of Blanket Change. And this is really a movement around this country. It's a movement so that moms and babies have the care and the help and the support that they need. In Blanket Change, what we're calling for is a three-pronged approach. One is eliminating the racial and ethnic disparities that we experience today, really emphasizing health equity. Second is around access, this idea of access to healthcare based on where you live. That should not be a barrier to whether or not you can have high quality, accessible healthcare. And then third is addressing the preventable health conditions that lead to some of these poor outcomes for moms and babies in the first place. So we're going to be digging into this Blanket Change agenda today. You're going to be learning about it, all of you all. We ask you all to take this moment. We're now heading into some of the most important elections in our lifetimes. Take this moment to make your voice heard, to be a part of the Blanket Change agenda. You can do that by going to blanketchange.org, and you can sign up to be an advocate. We have an easy to use action center. You can make your voice heard. And today, what you can do when you go to blanketchange.org is you can tweet to anybody running for Congress, folks running for a state office, anybody, whether they're Republican or Democrat. You can ask them to take action on behalf of moms and babies and address this maternal and infant health crisis that we're facing. We know that if we get every single concerned, interested, and motivated individual involved in Blanket Change, we can make a difference. We've seen that happen before, and we can make it happen again. So thank you all for joining us. And we want to say again, thank you to CQ Roll Call for hosting. And I'm going to turn it over now to Roll Call for our first panel discussion. Thank you.
Thank you so much for that incredible information, Stacey. We're going to kick off today's program. We have a lot to get to with Representative Dr. Alma Adams, my own representative in North Carolina, actually. And Representative Alma Adams was elected to her third full term representing the 12th Congressional District of North Carolina on November 6, 2018. And she's the co-founder and co-chair of the Black Maternal Health Caucus and the founder and co-chair of the Congressional Bipartisan Historically Black Colleges and Universities Caucus. Interviewing Representative Adams is CQ Roll Call's healthcare reporter, Sandhya Rahman. Sandhya, over to you.
Thank you. Good afternoon, everyone. I'm Congresswoman Alma Adams, and I'm so honored to represent the 12th District of North Carolina and to be the co-founder and co-chair of the Black Maternal Health Caucus. I really want to thank the March of Dimes for hosting this important town hall event. Clearly, now is the time. I'm so excited to celebrate the March of Dimes' new Blanket Change initiative, a massive advocacy campaign to encourage policymakers to make equity, access, and prevention to improve health outcomes for mothers and babies a top priority. So thank you for your commitment to improving outcomes for all birthing mothers, persons and babies, and especially Black moms and babies who remain our most vulnerable. The pandemic has underscored just how much more than ever the urgent need for everyone to have access to culturally competent and quality care. I look forward to the discussion.
Thank you so much for joining us, Congresswoman. I wanted to start off by asking what led you to co-found Black Maternal Health Caucus last year, and if you had kind of a personal connection to the issue.
Well, thank you very much for the question. For me, like countless others who are dedicated to this effort, this issue is really very personal to me. My focus on Black maternal health began when my daughter survived a complicated pregnancy that almost claimed her life and the life of my grandchild. So when I got to Congress, I knew that I had to make this a priority. And because my daughter and grandchild are not alone in their experiences, I thought this was important for the caucus to take on. Now, across the US, Black mothers are needlessly dying during what should be one of the most joyous times of their lives. And as you know, the US is one of only 13 countries in the world where the rates of maternal mortality and morbidity are worse today than they were 25 years ago. And so we continue to have the highest maternal mortality rate among wealthy countries because of the disproportionate death rate of Black mothers. Research shows also that the cumulative stress of racism and sexism undermines Black women's health and making them more vulnerable to complications that endanger their lives. To make it worse, the significant health disparities that Black mothers and infants already face are further exacerbated by COVID-19. So Black maternal health in this coronavirus era is truly a crisis within a crisis. It's absolutely critical then that we provide mothers and birthing persons the support that they need before, during, and after pregnancy. And that includes access to nutritious foods, paid leave, maternal health services, quality postpartum coverage, and a clean environment. So earlier this year, Representative Underwood and Senator Harris and I introduced the Black Maternal Health Omnibus Act of 2020, which is a package of 9 bills which build upon these concepts so that we would, through the Omnibus, diversify our perinatal workforce by investing in doulas and midwives and other community-based providers, extending the WIC eligibility for the postpartum period and for the breastfeeding period. And then to establish a grant program that would implement trainings on bias and racism and discrimination in maternity care, and so much more. So this Omnibus, with this, we've designed a roadmap. That's what we look at it as, a roadmap to ensure that our healthcare system provides regulators, lawmakers, and society to get them to the point where we finally make Black maternal and infant healthcare a priority.
So you touched on this a little bit already, but what has Congress kind of been doing to address maternal mortality rates this year, especially given the impact of the COVID-19 pandemic on healthcare?
That's a great question. You know, last month, the House passed an incredibly important maternal health equity package, the Maternity Health Quality Improvement Act of 2019. It's a bipartisan bill, and it has much of my Maternal Care Act, which funds training for healthcare professionals on bias, implicit and explicit, as well as provisions to improve maternal and obstetric care in rural communities. And so if it's enacted, it would be a critical step to end preventable maternal mortality and eliminate racial inequities in maternal outcomes. Another one of the most important impactful changes we can make to support maternal health is to expand Medicaid postpartum coverage from 60 days to a year. So earlier this year, we passed the Helping Moms Act, which will allow states an option of providing that needed 1 year of postpartum coverage under Medicaid, as well as under the Children's Health Insurance Program, or CHIP, as we call it. Unfortunately, though, the Maternal Health Quality Improvement Act and the Helping Moms Act have only passed through the House. And as you know, it also must get through the Senate before and on to the president before it becomes law. So we're hopeful that the Senate will take up these important measures before the end of this Congress.
So earlier this year, you mentioned the caucus introduced the Black Maternal Health Omnibus, and that combines a lot of different policy issues related to this issue. I guess, what are some of the challenges in getting that passed into law?
Well, as with any legislation, there are a number of obstacles, including, first of all, educating members of Congress. And that was one of the one of the reasons that we put the group together, but educating members of Congress on the importance and the need for this legislation. That way we can garner enough support to get the bills to the floor. That's really important. That's one of the main reasons that we created the Black Maternal Health Caucus. And I'm proud to say that we have more than 100 bipartisan members. And with the blanket change initiative, I know that we will now be joined in our fight by even more partners. But even with strong support, some legislative efforts take years, sometimes decades, and we don't have that kind of time. Unfortunately, matters have definitely been complicated further by this pandemic. So the urgent need to address the devastating impacts of this pandemic, including its exacerbating efforts on Black maternal health, has taken up much of the legislative calendar, and rightfully so. So thankfully, the House has still made time, even given all that we're juggling, to pass multiple packages to improve Black maternal health. We have raised the awareness, but there's still a lot more to be done. And I'm hopeful that the Senate will also refocus on passing substantive legislation, including the urgently needed legislation that will combat the Black maternal health crisis.
So a common theme that I've noticed in a lot of the bills on this issue, and you mentioned it yourself, is that is to extend Medicaid coverage up to 1 year postpartum. And I'm just kind of curious, why is that a big priority? Why would that kind of help reduce the maternal death rate?
Well, multiple, as I mentioned before, the House passed the Bipartisan Helping Moms Act. And of course, this allows states the option of providing the needed 1 year care of postpartum coverage under Medicaid, as well as under CHIP. And so this legislation, as well as the Mamas Act and other legislation to extend coverage for a year postpartum, is vitally important. So when we think about the Urban Institute, for example, recently found that almost 1/3 of women who lost Medicaid coverage and became uninsured in the postpartum period had conditions that require ongoing monitoring and care, like pregnancy-related hypertension. Also, 1/3 of new moms who lost Medicaid were recovering from a C-section, and over one quarter of them reported being depressed sometimes, or often always in the months after giving birth. So that's not acceptable to us. So we've got to provide quality postpartum healthcare coverage for all birthing persons and mothers and infants, and we've got to allow them to fall into the coverage gap at such an incredibly vulnerable time. Allowing them to do that creates a problem for themselves and their babies. And it also contributes directly to our nation's maternal health crisis. So it's really important that we extend Medicaid coverage to a year postpartum as soon as possible. We know, for example, that in the state of North Carolina, we did not expand Medicaid with COVID. The situation has been exacerbated. So again, I hope the Senate will consider taking up this bipartisan bill before the end of the year, and so that we don't lose another mother, another birthing person, or baby to this crisis. This is so, so critical.
Thank you, Representative Adams, so much for joining me today. We're delighted to have a brief video message from Representative Kathy Mcmorris Rogers, who unfortunately could not join us for today's live discussion.
Hello, everyone. It's Kathy Mcmorris Rogers. And I want to first say thank you to the March of Dimes. Thank you for your advocacy for healthier mothers and babies. Every woman's journey to motherhood is different. I was 35 and single when I was elected to Congress. Brian and I got married at the end of my first term, and I became pregnant shortly after. 3 kids later, I can testify today that becoming a mom has been the best thing to have happened in my life. Still, I can think back to the uncertainty, the fear. When I was pregnant, it was scary, especially the first time. Our oldest, Cole, was born with Down syndrome. The doctors gave us a long list of challenges and complications. But Cole's life couldn't be further from what we were told. He's opened our eyes to the dignity and the potential of every life. Cole is now 13. He loves sports, math, and he's a great big brother who brings us so much joy. For me, he's also made me a better legislator and reminded me for what I'm fighting for. A brighter future where every person is empowered to reach their full potential. As we often hear from March of Dimes, that must include both patients, mothers, and their babies. That's why, as a leader on the Energy and Commerce Committee, I'm working on bipartisan solutions to spur breakthrough research and lower infant and mother mortality rates. For example, the Scarlet Sunshine Act would enhance efforts to understand and help us prevent sudden infant death syndrome. I'm also a co-sponsor of the Helping Moms Act of 2020. The Helping Moms Act extends Medicaid coverage for up to a year postpartum. It will ensure more women don't fall through the cracks at a time when they need life-saving healthcare access the most. These bills have passed the House with overwhelming bipartisan support, and I'm continuing to urge the Senate to take action on them too. It's these kind of solutions that we need for America to win the future with better care at every stage of pregnancy and life. So again, thank you to March of Dimes and all those leading for healthier moms and families. I support your mission. As you say, every baby deserves the best possible start, and it starts with mom. Keep up the great work for Blanket Change. You are making a difference, giving people hope and saving lives. Thank you.
So I want to give a great thank you to Representative Adams and Sandhya for that insightful discussion, and to Representative Mcmorris Rogers for that thoughtful message. Now, I am delighted to be joined by a great panel, Dr. Rahul Gupta, who's the Vice President, Chief Medical and Health Officer, and Interim Chief Scientific Officer at the March of Dimes, and Jonathan Webb, who's the Chief Executive Officer at the Association of Maternal and Child Health Programs. Welcome. First, Dr. Gupta, if you can start off by explaining the motivation behind the hashtag Blanket Change campaign.
Thank you, Mary, and thank you everyone listening, and really a big thanks to my panelists here, Jonathan. Really appreciate the partnership as well as the work. We believe that clearly, and has been stated earlier, that the maternal and infant health crisis is complex, and there's no one-size-fits-all solution. We have to tackle it from multiple angles, focusing on everything from access to care, to physical and mental health, to the social determinants, and much more. We believe that a critical way to create positive change is through advocacy. That is the reason why we launched the hashtag Blanket Change digital advocacy campaign to call on organizations, to call on policymakers and political candidates to prioritize our nation's moms and babies and take immediate action to help end the maternal and infant health crisis. We believe that all these more than 70 organizations nationwide, including AMCHIP, American Academy of Pediatrics, and others that are coming together here to support this campaign, really stand alongside us to demand blanket change by demanding really equity, access, and prevention. It's exciting to see so many of partners come together to join this important movement in this moment of time in our nation's history. And we hope, certainly, that on this call, those who have joined us are beginning to take action now at blanketchange.org.
Great. I know that the March of Dimes did a report in September, and I would like for you to share with the folks who have gathered, what are some of the bullet points from that report that surprised even you and that need particular and immediate action?
Yeah, Mary, that's a great important point, because one of the things we wanted to look at, we had done a maternity care desert report back in October of 2018, and we wanted to follow that up in 2020 to see if anything changed. And we're indeed not surprised, but at the same time, I will count you for you and for our audience what we found. Basically, we found that a significant amount of counties across the United States still continue to have limited or no access to maternity care. Think of maternity care deserts like food deserts, except that we call a maternity care desert when a county has no OB provider or no hospital to provide that care. And there can be variations in insurance status. So we see that about 7 million women of childbearing age live in one version of a maternity care desert or another. We also know that this is responsible, these areas are, for about 500,000 births that happen in our country. We know that out of these, there is about 2.5 million or 2.2 million to be exact, women that are living in absolute desert, absolute areas. 35% of the nation's counties do not have this access, and it's unfortunate. We also know that all of these factors ultimately accumulate to result in poor outcomes. We used to think maybe it's a rural area problem only, but now we know that about a third of the deserts may exist in urban areas, often inner city metropolitan areas. So it's important that these moms who have already an increased chance of risks for maternal and infant health in terms of death and suffering, including low birth weight and preterm birth, we prioritize them. We also know that Black women, especially, have at least 3 times more likelihood of dying as a result of pregnancy-related complications as opposed to white women. And one of the factors there is, of course, is quality of care, but access is important, and availability of care is also important. So our idea behind the proposing and developing this maternity care desert report is to really demonstrate the unequal access to healthcare that so many of our populations continue to receive, and how that's unacceptable, and it is actively contributing to the rising tide of this crisis of maternal infant health.
Thank you. I want to bring Mr. Webb in right now, because Dr. Gupta has surfaced some really disturbing statistics and disparities. So I wonder if you could talk about the importance of eliminating particularly these racial and ethnic health disparities and what the current research shows us.
Well, Mary, thank you for having me first off. And Dr. Gupta, really appreciate the invitation and the partnership that we enjoy. It's a great question. And to answer it, I'll start with my definition, the definition that we've been working from on health equity. It really is around everyone deserving the right to a fair and just opportunity to be healthy. And frankly, we don't see this and haven't achieved this in the US, and is reflected in our health outcomes. As one of the richest countries in the world, we have the highest maternal mortality rates among developed countries. And Dr. Gupta touched base on this, but Black women are dying 3 to 4 times the rate of their white counterparts. The US infant mortality rate is 5.7 deaths per 1,000 live births. And those numbers by race and ethnicity show that the infant mortality rate for non-Hispanic Black infants is twice that of their white counterpart. So when we look at the importance of eliminating these disparities, it's because each one of these deaths, when you talk about maternal deaths, is the loss of a mother, the loss of a wife, a daughter, a friend, and a community member. And when you look at this through the lens of infant deaths, each one of these losses is the loss of a potential future leader, a world changer, a problem solver, a cure finder. And these losses are experienced not just by the families, which is a huge loss to the family, but it's also a loss to us as a larger community. So it's important for us to eliminate these disparities because the stakes are just simply too high not to. And to your question around what the research shows us, it shows us a few things. So one, as Dr. Gupta mentioned earlier, we have in the public health community, been looking at the social determinants of health, which are the conditions in the places where people live, work, learn, play, and those conditions affect the health and the quality of life risks and outcomes. We've started to transition to this life course theory approach and understanding, which is that the birth outcomes for mom and babies are not simply impacted by their experiences prenatally, but the experiences, traumas, the things they've accumulated and experienced throughout the course of their life. So where we are now with the research, pulling all this together, is that we are recognizing that the environments in which we live and develop, the social determinants, and the lifetime experiences that impact the health and outcome and maternal child health outcomes of life course theory are influenced by racism. And structural racism exists in every major system that influences those factors: healthcare, education, housing, workplace, child welfare, criminal justice, and it causes intergenerational stress for people it impacts, and likewise determines the investments and the policies that support or hinder community well-being. So if we are looking to really address this issue, we need to shift our conversation from eliminating racial and ethnic disparities in maternal and infant health specifically, which continues to focus the blame on people, to eliminating the systemic, structural, and institutional inequities that produce the racial disparities. We also need to be honest and acknowledge that these systems, these structures, and these institutions were not created to produce equitable outcomes for Black, Indigenous, Latinx, Pacific Islanders, and other people of color. These are products of systems created over time that create an advantaged group or a disadvantaged group, in part because communities of color have not had seats at the table in creating these systems. So where I'll end with this portion of the question is an analogy that I've heard offered a couple times before that really kind of brought this home for me, and it compared our system to a game of Monopoly. And for those of you, I think most folks are familiar with Monopoly, it looks at our system as this game where you have a game being played by a family of four, where three people sit down to play the game, and the fourth is asked to kind of finish their homework, do their chores, whatever it might be, while the rest of them play the game. While that person is doing their chores and their homework, the family of three has gone around the board several times. If you've gone around the board several times and then you're invited into the game, there's no more property. Everyone's got houses set up, they've got hotels set up, and you're coming into the game now just going around the board, paying $200 to pass go and paying others rent. And our system is set up in that way that if we don't look at really dismantling and look at the system that we're playing in, we're going to be building programs that give folks $200 to pass go, but not really address the inequities that are at the base of the game. So that's why.
Yeah, well, thank you for laying it out that way. I think it's a great time to transition to some solutions. So Dr. Gupta, can you give us some details on the work that the March of Dimes is doing to improve maternity care access?
Certainly, Mary, and thank you for that. We certainly have challenges. We continue to see challenges in our nation, even today. You know, one of the primary things we're doing is advocating for important policies that will expand access to care along with our partners. In fact, we've made great progress in just the last few weeks, if you look at it, because the House of Representatives and Congress have passed 2 bills that actually would help improve access to care. Now, we understand the realities, we understand the politics. However, I do want to hold up the great work that has happened so far. One of those is called the Maternal Health Quality Improvement Act of 2020, or HR 4995. It does a few things. It actually develops these health programs to improve access to obstetric care in rural areas. It reduces and prevents the racial and ethnic discrimination that happens, that Jonathan's talked about in maternal health. It improves perinatal care and health outcomes and eliminates preventable maternal death and severe health challenges. So there are solutions that are happening right now as we speak. Similarly, there's another piece of legislation that it's called Helping Medicaid Offer Maternity Services Act of 2020. That bill, HR 4996 companion bill, allows extending the access to health insurance for Medicaid and CHIP for mom up until 1 year after birth. these are the kinds of changes that need to happen now, urgently, and we really would like to see, amongst everything else that's going on, the Senate take these up and pass these important pieces of legislation. It can be done. It's a matter of those who are listening to us going to blanketchange.org and helping us achieve that. We also support some of the other pieces like the Black Maternal Omnibus Act of 2020, a package that actually aims to fill gaps in existing legislation to improve outcomes for Black moms, as well as the Family Act, which actually looks at creating affordable, sustaining national system to provide workers up to 12 weeks of partial income through family and medical leave insurance fund. So the bottom line here is that it's not a matter of what we don't know how to fix it. We know how to fix it. There are policy changes that can happen that can really change the way we take care of our people, especially our moms and babies, and certainly especially those of color that are bearing the most burden in this crisis. Yet, we need help. We need the help of those who are listening to us, who are watching us, to take action. Without that, we will not be able to change. So we're making a call of everybody to go to blanketchange.org and make it count for all of us, and especially for those who are the most vulnerable amongst us.
Oh, I want to thank you. You've given us our marching orders, Dr. Gupta, and a lot of action to be done. I want to thank you, Jonathan, Mr. Webb, and Dr. Gupta for speaking with all these wonderful listeners today and giving us some action items. I'd now like to pass the discussion over to Stacey, who will be moderating our final panel discussion, and her interview will begin in just a moment.
Good now?
Yep.
Hey, y'all.
Well, good afternoon, everybody. We're all here. It's great to see some of my good friends with me today. Charles Johnson and Allison Felix are pretty familiar faces around these issues around mom and baby health. They have been extraordinary advocates for maternal and infant health over the course of many months and years, and we are just so grateful to have them joining us today. And it's certainly my honor to have them as a part of this panel discussion. I want to remind everybody that we will be able to take questions, and I will be able to pose them to Allison and Charles. If you put them in the chat box, we'll be able to see them, and want to make sure you have a chance to ask questions and respond to some of the things that Allison and Charles are raising. So Allison and Charles, thanks for being here today. You all have been so vocal and so public about your stories. Would like for you to share a little bit about your stories today for those that may not have heard them. And I want to start with Allison. Allison, you have really spent a lot of time sharing your experience becoming a new mom with your beautiful daughter, Cameron. My daughters and I have loved seeing your story, have loved seeing you on your social media, sharing your experience. Can you just share a little bit about what you experienced as a new mom, giving birth, and tell us about some of the challenges you faced as you welcomed Cameron into the world?
Yeah, well, thank you so much for having me. It's really nice to be with everyone today. For myself, I had a really great pregnancy. You know, I knew I wanted to come back to compete. And so I trained throughout my pregnancy and I felt strong. I was, still running. I was in the pool. I was doing all of these things and feeling really good. And so I had a normal appointment at 32 weeks. I went in and right away, my doctor became concerned. I was spilling protein and she wanted to do further monitoring on me. So they sent me to the hospital. And once I got to the hospital, I was admitted. And that's when things really took a turn. Quickly, things kind of spiraled. I was diagnosed with a severe case of preeclampsia and it just got really scary really fast. I guess I had heard the statistics and I kind of, knew, but I just never, being a professional athlete and knowing my body and how to be healthy, I never saw myself in this position. And so when I was really confronted with this problem, it just I wasn't prepared. I don't think anyone is ever prepared, but I just, my mind wasn't there. And quickly things kind of just kept, getting out of control, and came to the point where, they had to make some really fast decisions and took me in for an emergency C-section. And, I think it was really scary for my family, kind of not knowing what was going to happen. My life was in danger and my daughter's life as well. And, went in to deliver, and I stayed in the hospital for a while after, still fighting some of those same complications. And my daughter was in the hospital for about a month in the NICU and fighting herself. And so a really scary situation, but we feel so blessed to have come out on the other side of it. And having come out on the other side, my eyes have just been open to what an enormous problem this is and how many people don't walk out of the hospital. And so that's why I think it's so important to share these stories of what is happening. Because, I think you can hear a lot about it, but once you do, someone or know someone who's experienced loss, it really changes things for you.
No, absolutely. And thank you for sharing that. I want to come back to you, but I want to turn it to Charles. And Charles, you've had an equally painful story and very challenging story with Kira, your wife, and in her delivery with Langston, so your second boy. So can you share a little bit about that story and make sure everyone knows what your experience has been as well?
Sure, absolutely. So first and foremost, just Stacey, thank you so much for having me. Thank you to your entire team. It's just awesome to be here with what truly has become like my second family, right? With you, with, Auntie Alma Adams, who's coming on later this afternoon. Allison, we have not met, but I adore you. And I'm so grateful for all the work that you were doing on behalf of families. And I saw your post that you just started training for 2021. Me and the boys will be there. We're coming to Tokyo, right? We will be there. We will be there to support, screaming super loud for you. So, so let's jump into it. So my wife, Kira, truly was, and I know those of you who have heard me talk before know that I can brag about Kira all day long. We're talking about a woman who ran marathons, who spoke 5 languages fluently, who had her pilot's license, who was a skydiver, who was truly just sunshine personified. So we welcomed our first son, Charles, in 2014. We had always talked about having back-to-back boys, right? So we were just so grateful when we found out we were expecting our second son, Langston. We had recently relocated to Los Angeles, California. And part of the painful irony of what I'm going to share with you is that we chose to deliver at Cedars-Sinai because it was our understanding that it was the best place to give birth. It was supposed to be one of the best hospitals in California and possibly the country. So at our doctor's recommendation, throughout Kira's entire pregnancy, she had been perfectly healthy, other than just a touch of nausea. All signs pointed to both her and Langston being extremely healthy. So on April 12th of 2016, very importantly, at our doctor's recommendation, we walked into Cedars-Sinai for what we expected to be the happiest day of our lives and walked straight into a nightmare. Langston was born perfectly healthy. Shortly after the delivery, they take us back to recovery. And that's when things began to take a turn for the worse. Around 4 o'clock in the afternoon, I noticed blood in Kira's catheter. I brought it to the attention of the doctors and the nurses at Cedars. They came in, they assessed her, they examined her, and they said they were going to do several things, including a CT scan that was supposed to be performed stat. In the interest of time, I'm going to condense this story so we can get to these questions, and this, what I know will be a very fruitful conversation. Kira was allowed to suffer and bleed internally for 10 hours while we begged and pleaded the staff at Cedars-Sinai to take action. And we got this runaround. For 10 hours, she was allowed to suffer. For 10 hours, she was allowed to lie there in excruciating pain while we advocated, did everything we could to get them to take action. By the time they finally took Kira back to surgery, keep in mind, we went in for the delivery at 2 o'clock in the afternoon. It was 12:30 the next morning. When they opened Kira up, they found 3.5 liters of blood in her abdomen for where she had been allowed to hemorrhage and bleed internally for 10 hours. They worked on her for some time, but they weren't able to save her. And I know we'll get into it, but Kira, much like many of the mothers all around this country, deserves so much better. And that's why I'm proud to be here with you today.
Yeah. Well, and every time I hear both of your stories, it just reminds me of, what we have to do to make this system work better for all moms and all babies. And, I know I speak on behalf of a lot of folks that are joining. We're so sorry for the pain you've gone through, the losses you've experienced. These are things that just shouldn't happen in 2020 in the wealthiest country in the world.
Absolutely.
Allison, I want to turn back to you because, I think what's really interesting about both of your stories, Allison, you're an Olympic athlete. And if anyone didn't notice, just look at her necklace to tell that. But we all know you, and we know you are at the peak of your health, and you were when you were giving birth to Cameron. We know Kira was in excellent health. So why are these things happening for women who have access to the best medical care in the world, Charles, as you mentioned? Women that have access to resources, but these are women of color. Allison, you as a woman of color, Kira. So Cameron, Allison, sorry, what would you say is your biggest plea as a woman of color to the healthcare system to address these issues that we're facing?
Yeah, I mean, I think the thing that just really stands out to me, and again, listening to Charles' story, and it's just so heartbreaking because these things are preventable. And I think I would say the biggest thing that I hear is that we're not being heard. I think we're bringing our pain out there and we're having to advocate for ourselves. But that shouldn't even have to happen. You shouldn't have to be screaming that something is wrong to be able to get attention brought to these issues. And I think that's one of the major problems. It's already intimidating enough to go into a doctor's office and here is someone that you should be able to trust. And, they are the experts. But when your pain is not, being heard, it really gets to a scary situation.
Yeah, and can I just ask a question that's come in, Allison? I probably wasn't supposed to do this, but I do want to make sure people know I'm seeing the questions. Question for you, Allison. What, if anything, do you think could have been done to prevent what you went through? That was a question on Facebook.
Yeah, I mean, I really feel like, right away when you are going into your doctor's office, knowing that you're at risk, I think that's number one, and that's why I think awareness is so important, and why these conversations are so important because, it might not have changed anything, but knowing the signs to look for, knowing the swelling or the things, that could happen, and being able to, put in place a person, whether that's your partner or whoever it is, to make those decisions when things really take a turn. All of those things are helpful so that when you do find yourself in that position that, at least there is a plan in place and, you can move forward in that way.
Yeah. And Charles, you have turned your pain into incredible advocacy and action. And both of you all are doing this outside of your day jobs, right? I mean, you have families you're trying to raise, you have professional pursuits, you've got a lot of things going on, but you're spending a ton of time on these issues. How did your experience kind of propel you into this place of advocacy? And tell us a little bit more about why you are such a proponent of blanket change, this effort to address the policy changes that are needed.
Sure, absolutely. So for me, Stacey, frankly, when we walked into Cedars-Sinai on April 12th of 2016, the notion that Kira would not walk out to be here to raise her sons, it never crossed my mind, right? I was like a lot of Americans, I was oblivious to the fact that this was even going on. So when this first happened, of course, my world was shattered. But then as I began to hear these stories of other women, right, who had very traumatic birthing experiences and near misses like Allison, or other women that had died in childbirth, I'm beginning to think to myself, something isn't right. And that's when I did the research, and I was just blown away by the fact that we are in the midst of a maternal mortality crisis that is so shameful. But not only was I shocked by the fact that we were in this crisis, I was even more appalled by the fact that nobody was talking about it, right? That this was America's dirty little secret. And so I felt like I had to do something. I didn't know what I could do. I didn't know how I could make an impact, but I felt like I owed it to Kira and I owed it to my sons to do whatever I could to raise my voice, to try and prevent our nightmare from becoming other families' reality. So that's how I began to advocate. And honestly, I didn't know what to expect. And, you know, I probably naively thought that I would share Kira's story, and if people took notice, and if we got a couple people to write some articles or to say stuff about it, it would be great. And then I would go back to being a soccer dad in obscurity and trying to raise my boys. But God and Kira had very different plans for my life. And so moving forward, once we began to get traction and to raise awareness, I really wanted to figure out what we could do to create substantive, long-lasting, institutional level change. And so it's when I began to advocate for policy. I was fortunate enough to work in partnership with you in the March of Dimes to get HR 1318 passed, which is the first ever federal piece of legislation to prevent women from dying in childbirth. And so when we talk about where we're at now, at this pivotal moment facing the eve of the 2020 election, it is so critical that while we talk about all these issues that divide us, we come together around an issue that can uniquely unite us, and that is the health and well-being of mothers and babies in the United States. I don't care if you were with, you know, I say this all the time, Stacey, I don't care if you were with the Republican Party, the Democratic Party, the After Party, I don't care who you were rolling with. When you roll up to the polls, you need to demand that if somebody is going to get the privilege of your vote, that they have a comprehensive plan, even on the local level, the state level, to make your community, your state, and this country a better place for mothers and babies.
And we're so grateful for your advocacy and you being a part of Blanket Change and all the other work you've been doing, testifying on the Hill. Charles, you've been a very powerful advocate for sure. And again, we want to remind everybody that if you want to be involved in blanketchange.org, just go to Blanket Change, but in Blanket Change and policy change, go to blanketchange.org and be a part of this movement. I want to touch on one last issue, which is, you know, we talk about what the healthcare system needs to do differently, but within Blanket Change, we're talking about what moms and families and babies need, you know, to be able to live a healthy life. And one of the things that really has come out in your experience, Allison, has been around what employers and what this country needs to do to support moms before birth, during birth, after birth. Paid family leave is really an important issue, and you've been a big advocate for it. You know, we are one of the only industrialized, if the only highly industrialized country that does not have a national mandate for paid family leave, which is really incredible. And this puts enormous stress on women, working moms. We did a study, the March of Dimes, that showed 1 out of 3 women said that if without paid family leave, that they would have to leave their jobs after 1 year of having the baby. That destabilizes the financial stability of a family. It takes a woman's takes a woman off track from her career and professional growth. Talk about, Allison, if you can, just briefly, the importance of paid family leave and what employers need to be doing. And I know you have a personal experience around this of advocating, demanding for the kind of support from your employer or someone very much supporting you financially. Can you talk about the importance of paid family leave in this country for families and women?
Yeah, I mean, I think it's crucial and it definitely has to be addressed. In my own experience, you know, you never know what type of birth you're going to have or what complications you're going to face. But regardless, the time after you give birth can be very difficult. Postpartum is, it's very interesting of the emotions and all of the things that you go through, and also the time to bond with your child. And it's not just an experience with a mother, but it's a whole family, you know, so that's why this is so important. But I just recall, you know, after having my daughter and sitting in the NICU, which is such a heavy place to be already, and, you know, trying to be there and support her and still dealing with my own health, But in the back of my head is also that I need to get back on the track, that I need to do all these things because my livelihood depends on it. And I think about all the other mothers, across industries who have these same issues, who are going through all of these same things. And it is a really, really difficult thing to be pulled in all of those different directions when your heart is with your family and spending that crucial time together in those precious moments. So it's an area that we have to do more. I felt like it was really important for me to share the challenges that I was facing with my employer and what I had seen throughout my whole career surrounding pregnancy in the culture, and how women felt they had to really kind of be silenced in order to secure their livelihood. And I just never want anyone else to have to go through that experience that I did, and that so many other women have and are still going through.
Absolutely. I know we need to end this discussion. I wish we had so much more time. But Charles, just to bring this to a close for both of you all, I'll start with Charles. What is your wish for changes in this healthcare system? If you are again in front of policymakers and in front of the American public, what do you want them to know, especially with the November elections right upon us, right? What do you want them to know? What do you want them to understand about moms and babies today? And what change do you want them to really push for?
There is nothing that can replace a mother, period. And that for all our riches, for all of our accomplishments, for all of our international bravado, if we are not protecting mothers and babies in this country, then what are we doing? The right for a mother to give birth to a child and then be around to raise her, it's not a women's health issue. It's not a maternal health issue. It truly is a human rights issue. And we have to do everything in our power to frame the conversation as such. And I also want people to understand that the other thing about this, while it seems like there's a lot of dragons for us to slay, at the end of the day, be encouraged if you believe in this work and you're on the front lines, because the great thing about it is this is something that we can fix, right? This is something that we can fix in our generation. I refuse for this to still be a problem when it's time for my boys to have babies. I refuse for this to still be a problem when Cameron decides to have a family of her own, right? Our time is now. But we have to be assertive. We have to keep pushing this conversation, and we have to not ask, but demand. And that's why I love that you framed it like this, Stacey, because I know that probably was up for demand change. We're way past asking. It's time to demand change and demand better.
Demanding change, that's right. And Allison, just to close us out, what do you want to say to the public and policymakers about what we need now?
Yeah, I just really echo what Charles just said. Charles, I think your advocacy is so inspiring.
Thank you so much.
To speak, and we're just so grateful. And I think we have to keep sharing these stories, keep these conversations going, because we have to be heard. Women of color, we should not have to advocate for ourselves, but we do. And like Charles said, this is preventable. And so we have to keep pushing forward to create change.
Absolutely. Well, it is really an honor for me to be with both of you all today. And we're so blessed to have both of you all as a part of this. And I know our work is ongoing. It's going to continue, and it won't stop until we get to a place where every mom and every baby has a chance to be healthy, and every baby has a chance to grow up with his or her mom. And that is our aspiration. And that's what we're all fighting for. So thank you all so much for joining us today. And it's a pleasure to be with you.
Thank you so much, Stacey. Thank you, Allison.
Thanks, Charles. Thanks for having us.
All right. Thank you so much.
Thanks all. Appreciate it. Well, listen, thank you all so much for joining us this afternoon. And it has really been, or maybe this morning, depending on where you are, it really has been an incredible conversation. For all of you all that have been watching, we really hope that you'll join us in this fight. This is all about asking people to become a part of this movement around blanket change. And again, we've said it before, if you want to be a part of this fight, if you want to make sure that your voice is heard, especially for those that are going to receive your vote come December or November, or whenever you're planning to vote between now and November 3rd, please make sure that they understand that you are asking for them to take a stand for moms and babies, and join us in this effort. We have now 70 organizations that are a part of blanketchange.org that are all working and fighting to sign up advocates to be a part of this. I want to just give a special shout out to Justice for Demi and Malachi for going above and beyond and helping us with a great push to drive new advocates here in the last 48 hours. And also thank you to some of our advocates who've already taken action, folks like Megan Helene and Lynn Green and so many others. Thank you for doing that, and keep it up, keep doing it, keep pushing hard. Again, go to blanketchange.org, go to the Action Center, read the policy agenda that we're advocating for. Make sure you understand that this is all about making sure that we deal with the issues of equity, access, and prevention for all moms and babies. And remember to vote. Vote. Vote only one time. Vote early if you choose, but vote by no later than November 3rd for the candidates that will prioritize, that will stand for what you are standing for, which is around the health of every mom and every baby. Again, I want to thank you, Mary, and I want to thank CQ Roll Call for our partner on this. And thank you for joining this afternoon, Mary.
Well, thank you, Stacey, and to all of the speakers who joined today for this important and timely conversation. I want to take a brief second to say it's a conversation that particularly resonated with me as an African-American woman who had a challenging childbirth experience, but I was so fortunate to have access to quality health care. I know many do not have it, but every mother deserves it and every child deserves it. So kudos to the March of Dimes, their partners, and hashtag blanket change. If you missed any portion of today's program, it will be available on rollcall.com and on Roll Call's YouTube and Facebook page. For the latest legislative news and analysis, follow Roll Call and tune in to my podcast, Equal Time, every other week when we tackle policies and politics through the lens of social justice, illuminating the issues that have been, and in some cases still are, dividing the country. Please enjoy the rest of your day, and thank you.
Thank you.